Breast cancer is one of the most common type of cancer in the world and even in Nigeria. It has claimed the lives of so many women, young women, even middle age. So today on the program, we're talking about breast cancer, and I'm sure you all know that this month, the month of October, is set aside to create awareness on breast cancer. My guest today will be telling us all we need to know about the causes, the risk factors, and of course the preventive measures. Plus, we have a feature on leukemia. Leukemia is a type of blood cancer. I'm sure you'll be wondering, is everything on cancer today? Yes, because they say early detection is key. So if you have any issues or any kind of signs and symptoms, watch out for today's edition because we're talking about breast cancer. My name is Nkem Okibi, and you know I love to do this with you every week. We'll go on a short break. When we return, you'll meet my guest. Stay with us. My name is Nkem Okibi, and you're welcome to this week's edition of Health Watch.
Those drugs are prescription only, and they are only to be dispensed by pharmacists because we know how they work and we can save you from using it inappropriately.
But at least if you have a cervix, you have a huge chance of never having cervical cancer.
Lack of drug compliance, proper drug compliance. Probably the patient did not take it the way it has been taken.
Glaucoma is the second most common cause of blindness worldwide, and glaucoma blindness is irreversible.
Before a dental surgeon practices anything, the ethics says a patient must go through a dental therapist.
Find out on this week's episode of Health Watch. All right, you're welcome back, and the program is still Health Watch, reaching you on the station for excellence, NTA Lagos Channel 10. And before we went on that break, we talked about our topic on breast cancer. My guest today is Dr. Oluwatoyosi Afolabi. She's a public health physician. You're welcome to Health Watch.
Thank you very much, Mr. Kim.
The month of October is set aside for the awareness, to create awareness on breast cancer. And this is one topic that makes me emotional. And that's because I've lost a lot of people, very close friends, family around me. I find it difficult to understand why people link religion and health issues. I would just say that, where are we at this point? What's happening in terms of awareness? What are we supposed to be doing this month?
Okay, thank you very much for having me here, Mrs. Nkem. It's really a great delight to be here today to talk about breast cancer. For us in Nigeria, and worldwide, breast cancer is the most common cancer worldwide and even in Nigeria. Every year, about 1.4 million people die from breast cancer, and it's quite very sad. Now, when we talk about breast cancer, what do we mean exactly? There are several cells within the breast, and the cancer of any part of those cells is what we refer to as breast cancer. So the breast contains, there are cells in the breast, we have the ducts, we have the lobules that are there in the breast. So the cancer of those is referred to as breast cancer. Now, what are some of the things that are responsible? You know, you made mention of something that religion, and then what has it got to do with breast cancer? Unfortunately, in Nigeria, most of the cases that present to the hospital, that we see in the hospital, are mostly advanced cases because of the different factors associated with religion here in Nigeria.
I'm glad you're on the show today. I would like you to talk about identify the causes of breast cancer, because I don't know why people attach spirituality to health issues. So you see, people say it's a spiritual attack, it's a spiritual. What people are the causes
of breast cancer?
Yes.
Thank you very much. On like several other cancer, unfortunately, we cannot specifically say that there are causative agents towards it. But however, there is something we call risk factor, and as the name implies, risk factor, meaning if someone has some of these things, it can predispose them, make them more at risk of having the condition. When we talk about breast cancer, the risk factors associated with breast cancer, there are some that are modifiable, meaning in the regard that there are some that, okay, if worked upon, can further reduce the chances of the person having breast cancer. But there are some that are non-modifiable. Let me start with the modifiable one. One of it is the aspect of smoking. Now, as smoking, as everywhere as it stands, it has been found out that women that smoke has more risk of having breast cancer, and the reason why is because the tobacco contained in cigarettes has some substances that make them more predisposed to having breast cancer. Those substances cause the like I talked about, the cells in the breast to grow more rapidly. Then alcohol as well. Has also been found out that women that smoke and that take more alcohol, like the higher the consumption of alcohol, the higher the risk of having breast cancer. Then the other thing as well is late pregnancy. Now, the funny thing about it is that breastfeeding is a reducing factor actually for having breast cancer. But however, for women that tend to get pregnant late, especially for their first kid.
When you say late, can you put an age to it?
Okay, there's something we call high risk pregnancy in obs and gynae. So that's like about like 35 years and above. Okay. So the later the age of having the first pregnancy, the more the risk as well of having like all this cancer and like some other cancer, even apart from breast cancer, like endometrial cancer, for instance. Then aside from that, too, obesity, then inactivity, have also, like I mentioned earlier, these are risk factors. That does not mean that everyone that is obese will be having breast cancer, not at all, but they are risk factors. So those are the modifiable ones that can be worked upon. But we have unmodifiable risk factors as well. An example is a family history. We unfortunately we can't change the family that we have from. I mean, we are born into that particular family.
Can't choose your family.
Exactly, we can't choose our family. So for people that in the family, maybe there is someone that has breast cancer or maybe even ovarian cancer, they have more risk of having breast cancer. Then aside from that as well, there are some genes that have been implicated in breast cancer. We call them BRCA1 and BRCA2 gene. So for women that unfortunately possess that gene, they are also at more risk of having breast cancer. Then we also have age as well. The incidence of cancer, not just breast cancer, almost every form of cancer generally also increases with age. But unfortunately, even of recent, we've been having young people come down with breast cancer. I think we've seen a lady of about 25 years old coming down with breast cancer. That's the reason why I will go back to the first point I mentioned earlier, that prevention is better than cure, and then early detection as well also help.
So what are the signs and symptoms to look out for? There should be a sign that if you see it, you just know that this could be a certain type of
breast cancer,
and then you need to see a doctor. So it's important we talk about it, because I know that there's also a myth about the color of underwear you wear. I've heard some people say that if you wear a black bra, you are at risk of getting breast cancer. And you know this woman thing. Every female I know loves black bra. At least you must have one black bra.
Definitely.
One particular one you're always wearing.
Definitely.
So if you now say black bra could expose you to the risk of getting breast cancer, what happens to people that they are in love with
only have black bras?
Okay.
Okay, so let me start from that. I don't think it has been proven that wearing black bra will cause breast cancer. But however, the signs and symptoms of breast cancer include 1, lump. Now, that does not mean that for every lump that is felt in the breast that immediately is breast cancer. No. But for breast cancer, one of the symptoms is having a lump in the breast. That's 1. Then 2, for the nipple as well. The nipple, there can also be some changes in the nipple. For some people, they have retracted nipple. That's like the nipple going inwards. And for some, they start having discharge. This time around, not milk. They start having like bloody discharge from their nipples. Yes. Then aside from that as well, the color of the skin of the breast as well also changes. I don't know if you've seen like you've seen an orange before, yes. So for some people that have breast cancer,
in Nigeria, the color of orange is yellow.
It's yellow.
It can be green. It can be lemon green too.
This one is even like the skin, the way it has pores. So we call that pod range. So for some women, they can also experience that as well. They start having like changes that look like the skin of the breast is turning to the skin of an orange within the breast. Yes. Then for some, they can also have like a swelling, a change in the size of the breast. For some, the size can increase, while for some, the size can reduce. Then at the same time as well, there can also be like for advanced cases, you can have like fungating breast mass. So at the point in time, the breast can ulcerate, then it can start becoming like, fungating as well. Yes.
Can you make that simpler?
Okay. So what I mean by it is that try to imagine a wound that is decaying, that is not healing. So they just have that on the breast, and that would take me to self-breast examination. For some cases of breast lump generally that we've seen in the hospital, it has been detected by the male partner. maybe the boyfriend or the ex or whatsoever during the point of having like sex, while trying to like do like fondle the breast, they realize that, oh, you have a lump, and then they go to the hospital and have a check. We've seen some patients like that. That would take me to self-breast examination. I think it's something that every woman should know, that the breast is, I mean, it's for them, it's theirs, even before the partner or the other person. They should be able to examine their breast monthly. Self-breast examination is something that's really proven helpful when it comes to breast cancer, and it should be done monthly and should be done 7 days after each menstrual cycle. There are a lot of videos out there, especially on YouTube, that can help people know how to do self-breast examination. But just to explain it very briefly, for doing self-breast examination, it should be done monthly and 7 days after the last menstrual period. And when you want to examine the breast of, let's say, like the right hand side, for instance, it simply just involves like putting the left hand side, the other hand on the breast, dividing the breast into 4 parts and examining it well, and also doing the same for the other breasts. Doing this monthly will also help greatly, because if there's any change in the breast, you'll be able to know that, okay, I'm experiencing something. And as far as the breast as an organ is concerned, any changes, anything seen whatsoever should not be taken with just levity, that, oh, it's nothing. It's best you present it at the hospital, then the doctor tells you, oh, it's nothing, you can go back home, than for you to just say, and this thing is there, this thing is there, then every day it keeps growing, it keeps undergoing different changes. So those things are very, very key.
While I was doing research, I saw a particular history of men having breast cancer.
Yes.
So we'll come to that. We'll go on a short break. When we return, Health Watch, continue to stay with us.
As Nigeria joins in the global fight against COVID-19, we must all take responsibility for the health of our loved ones. COVID-19 knows no borders, age, gender, tribe, or state of origin, and most importantly, it has no cure for now. The only way to defeat this unseen enemy is to prevent its spread by obeying the NCDC guidelines on COVID-19. Wear face masks in public places and maintain physical distancing. Wash hands regularly with soap for at least 20 seconds. Do not sneeze or cough into the open air. Instead, use tissue paper or sneeze or cough into your elbow. Generally avoid crowded places. If you develop any symptom, don't wait till it becomes severe. Get tested immediately. Check into an isolation center if you're positive, and remain there until you test negative. COVID-19 is real. Let's fight it together.
This message is endorsed by the Broadcasters Guild of Nigeria, BGN.
You're welcome back. The program is still Health Watch, and our guest is still in the house, Dr. Oluwatoyosi Afolabi, a public health physician. And our topic today is on breast cancer. Before we went on the break, we talked about signs and symptoms of breast cancer, and I mentioned that I'd seen during the research I saw where a history of men having breast cancer.
Yes.
And I was going to ask, is there anything like that?
Yes, okay, so thank you very much for that. Because, I mean, so the men will not feel like, oh, this breast cancer thing is just a women thing, that the women should just sort it out themselves. But actually, there are also some few cases of men also coming down with breast cancer. The only thing is just that as compared to women, the cases of breast cancer among men, the prevalence is very, 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 very few. But like I mentioned earlier, that there are some men that have been responsible for them, letting their female partner to even know that they have a lump. So this thing does not exclude men. Men are also involved as well. But just that the incidence when it comes to breast cancer in men is quite few as compared to women. So it's very possible for a man to also have breast cancer.
What are the likely complications, just in case you don't attend to presenting early if you have the symptoms of breast cancer? What could be the likely complications? Okay,
in fact, the mortality for breast cancer in Nigeria is quite higher as compared to like some other like upper middle income countries, and one of the reasons why is because of late presentation. When there's late presentation, not even just for breast cancer, for any health issues, when there's late presentation, then there's more risk of complication, and then the prognosis become poor. So the later the presentation, the poorer the prognosis will be. So when it comes to breast cancer, the main complication common with breast cancer is metastasis. That's the spread of the cancer from one part of the body to the other. When it comes to breast cancer, the cancer can spread from one breast to the other breast, and from there it can move to the lungs. Then from there it can move to the lymph nodes. Lymph nodes are all over the body. They are the one responsible for taking like fluid all over the body. So by the time you have that spread, by the time it gets to the lymph nodes, it can get to any other part of the body, the ovaries, the womb, any other part.
You know, I mentioned earlier that I lost a lot of friends,
Yes,
but I lost a very
unfortunately.
dear colleague.
So sorry
And
about that.
I would like to actually know, is breast cancer treatable?
Okay, thank you very much for that. To start with, is like I said earlier, my condolences for the colleagues. I think if you interact with most women in Nigeria, you most likely see one female that knows someone else that probably has been, has lost someone from breast cancer, and is quite unfortunate because the mortality rate in Nigeria as compared to other countries is very alarming. But the thing about it is that for breast cancer, early prevention is the early presentation at the hospital rather is very key, is very paramount. The National Health Demographic Survey, the latest one conducted in Nigeria, revealed that most women depend on their male partner before they make decisions as pertaining to their health. And it's very unfortunate because that's where the realm of women empowerment comes in. Women should be able to make decisions as pertaining to their health by themselves without having to wait for the male partner before going to the hospital. There was a patient I think we eventually lost her, unfortunately, then, because she presented very early and she was advised to have a surgery done, but she kept on delaying it because she was thinking, what will my husband say? What will my husband say? My husband will start looking at other girls outside there, until it became very advanced. And if you interact with several women that have breast cancer, that's part of their challenges, unfortunately. But what I want every woman to know out there is that having breast cancer is not the end of the world. Having a mastectomy done, that's the removal of the breast cancer, part of the breast rather. Having a mastectomy done is not the end of the world either. We have people, we don't call them victims, we call them breast cancer survivors that have done mastectomy, that have done chemotherapy, and they are doing very fine, living their life to the fullest. So you are also a survivor. I mean, for anyone having it listing out there, you are also a survivor as well. So don't feel intimidated about it that, oh, if you have your breast removed, there are some surgeries that can be done. They call it breast reconstruction surgery that can help to replace that part of the body. So that's why we have so many women that are out there, that are depressed out there. I mean, when you see them having the chemotherapy session, because by the time the breast cancer is advanced, it becomes, from one course of chemotherapy to the other. And unfortunately for some women, they never achieve that, that recession, like that being free, that being cancer free.
But do we have enough facility on ground?
And unfortunately, unfortunately, even apart from, we don't even have enough. I will not say that Nigeria is the health system is that structured, that equipped for, having like several chemotherapies out there. And even aside from that, the National Health Insurance Scheme does not even cover chemotherapy sessions, does not cover the payments for chemotherapy. So it's an out of payment thing, and it's not every woman out there that is able to avoid that payment. So that's another challenge that we also have as well. But fortunately, I think the Lagos State even has a mammogram screening facility.
Oh, great.
And I think as compared to like several other states, I think Lagos State is relatively doing well in the aspect of encouraging women to come for mammogram screening. Maybe one thing that was mammogram screening rather. So for every woman that is, like I mentioned earlier, one of the risk factors for breast cancer is advanced age. So for every woman that is above 45 years, they are encouraged to have a mammogram done every year. So mammogram
every year,
just once in a year. Yes. So what mammography does is the fact that it's just helps to screen for the tissues in the breast, just to be sure that okay, they are all cancer free.
All right, doctor, very quickly, what are the preventive measures to breast cancer?
Okay, thank you very much. Earlier I talked about self-breast examination. Doing that will also help. Though that exactly will not prevent it, but doing that will help to be able to pick if there is anything in the breast early enough. Then aside from that, for the modifiable risk factor, smoking, taking alcohol and all, I mean, even if it can be stopped entirely, but if it can be done, reduced to a very negligible extent, then aside from that as well, it still boils down to early prevention, early detection rather. Presenting early at the hospital will really help a long way. I once worked as a research assistant in a center that has to do with breast cancer. So one of the things that we noticed while following up hundreds of women that have been diagnosed with breast cancer before, is that one, they all presented very late, and within 1 year of follow-up, unfortunately, we've lost quite a number of them. So early detection is very, very, very key. And then staying away, reducing the amount of like cigarettes, and then alcohol consumption will also help. And doing self-breast examination. Is your breast, feel free to touch it and examine it and press it.
Thank you so much for coming on the program. We'll be speaking with Dr. Oluwatoyosi Afolabi, a public health physician. Thank you so much. I love the fact that we're both wearing the same color, almost the same color to identify with the breast cancer awareness month.
Yes.
Thank you so much.
Thank you.
And that brings us to the end of this week's edition of Health Watch. The doctor has said a lot of things today, and I can as well add to it that for all kinds of cancer, early detection is key. For all the women, and to all the women around, and to all the women watching me right now, please ensure that you do a self-examination on your breast. It is your body. Check your breast. And if you feel any kind of lump, please see your doctor. And if you feel any kind of the symptoms, one of the symptoms or some of the symptoms she mentioned today on the program, please see your doctor. For inquiries, for comments, or for questions, send them to okibenkem@gmail.com or ntalagoschannel10@gmail.com, or send a text only to 07060865487. Remember that COVID-19 is real. Go out there, get vaccinated, take care of yourself, protect yourself, your loved ones, and everyone around you. My name is Nkem Okibe. Join us same time, same station next week. See you then.